For a lot of people, sitting upright in this position without the hips hiked or the knees lifting up off the floor can seem almost impossible. Getting into the position is an important part of this, and for some people, that can make or break the move. Start out with your feet wider than hip width, and if you're not used to this position, you don't have to be fully straight up like this. You can lean back slightly. When you lean back slightly, you take the pressure off the front of your hips and your lower back, and that gives the ball in the hip joint more room to rotate in the socket. This is not cheating. This is just making the movement more accessible in the beginning. As you get better control, you'll be able to sit up taller, but you have to earn that. You don't want to force it. Now, here's one of the most important parts. When you turn into the position, you don't want to just throw both legs over at the same time. That usually turns into momentum and you get twisting and turning from the lower back. Your goal is for this leg to lead the movement. This is going into external rotation. That doesn't mean that this leg isn't going to move. Because the hips are connected, that's obviously going to happen. But the goal is still to get this front leg as close to the floor as possible before this leg touches the ground. This front leg is in external rotation at the hip. And this matters because this is what allows your pelvis to turn without twisting your lower back. Now, if this front knee doesn't go all the way down to the ground, it's usually not because of tight muscles, but because the hips don't feel safe in that position yet. And to help with that, you can take this yoga block and place it underneath your knee. You can also lean slightly back. You're not forcing the position, you're allowing your hip to learn the movement. Over time, you can go less till eventually you've got it down to the floor and you're more straight up. Now let's talk about this back leg. Internal rotation is often stiff and unfamiliar for a lot of people, and your nervous system does not like reintroduction of a movement that has been unused for long periods of time. So the nervous system creates tension. So for that, you can place the yoga block underneath your knee or right up here, whichever is more comfortable. You can also slightly lean back and over. The goal is control, not forcing your knee to the floor. You want to start being comfortable with the movement, and then you can do the same thing with the front knee. You can reduce the amount of height and eventually get comfortable in the position, and then ultimately stop leaning and become more straight up. When you want to switch sides, you follow a similar guideline. You lift the back leg first, and then you lift the front leg. This movement, when done properly and also within your range of motion, will help with things like squats, lunges, walking, getting up off the floor, and even protecting your lower back.